Well, in addition to those quadrants we just covered and we just talked about, there's also another way of subdividing the body, and these are the 9 body regions. And body regions are used to describe organ location and origin of pain. Those of you interested in working in nursing, especially in diagnostic medicine, will be using these regions as much, if not maybe more often, than you're using the body quadrants. So let's take a quick look at those and what words are involved. I'm not interested in you memorizing the regions exactly where they are. It's more focus on the words in this section, because I am not going to test you on which region is located where, but you may be tested on what the words mean. So to review our prefixes for body regions, we have hypo, which means below. And we see that illustrated here in the lower left picture with a dog sitting below the table, and epi, meaning on, upon, or over. And on the right, we have the bad doggy who's on the table. The suffixes we'll be using, once again, are all pertaining Jews: al, ar, iak, and ik. And the combining forms. Now, these are going to be useful. Some of these you've seen, some you haven't seen yet, some you will see again later in the semester, so it's good to learn them now. Once again, you still may be tested on the words, even though I'm not going to ask you exactly where the regions are. So the combining forms that we're going to be focusing on with body regions are chondro, meaning cartilage; gastro, meaning stomach; lumbo is lower back or loin; umbilical, which is the umbilicus, the navel, or the belly button, depending on which word you've chosen to use for that particular anatomical landmark; and inguino, which means groin. The word inguino has often been confused with the Italian pasta linguine, and I've heard students, I have actually not heard, but seen students write the definition linguino instead of inguino. So I'm pointing that out because I've seen it almost every semester, but I've seen it less since I've seen it. There may come a time when I have these spelling words out, probably not this semester, but it might happen. If it does and this word comes up, it is spelled without an L. Okay, we put all those together and we get hypochondriac, and that's pertaining to below the cartilage. Do keep in mind that these slashes here do not exist in the real words. They are simply used here to show the word parts. So once again, hypochondriac, pertaining to below the cartilage. Epigastric is a very common term to describe stomach pain. It's pertaining to upon or on the stomach. You will hear that all the time in clinical medicine, that someone's complaining of epigastric pain. So it's a common word. As well as lumbar, pertaining to the lower back. Maybe you've heard of lumbar support or lumbar spinal pain. The lower spine is usually the source of pathologies related to, related to pain. So lumbar is a word you're going to hear a lot. Umbilical is pertaining to the umbilicus. Once again, that's talking about the belly button or the navel or whatever your chosen word is. Inguinal is pertaining to the groin. And hypogastric means pertaining to below the stomach. And so those are your body region terms, and here's where they're located. Once again, I am not going to test you on the location of these regions, but you may be tested about the actual words. So we may say define hypochondriac. If you know that you do the suffix first and you say pertaining to, hypo means beneath and chondro means cartilage, you'll know that it means pertaining to below the cartilage. So that type of thing you may get questioned. I am not going to ask you where the epigastric or the umbilical regions are, although once again, nurses, if you learn them now, it's one less thing you have to deal with later. Okay, we're going to go into some procedures now. We're going to take the suffix endo, and we're going to take scope, the prefix endo. Caught myself there. We're going to take endo, and we're going to attach it to the suffix scope, which means instrument for viewing. If you look beneath that, you'll see endoscope, or endoscope is how we would typically say that. This is the instrument for viewing the inside of a body cavity or organ. Likewise, we take the same prefix, endo, and we attach it to scopi. And remember the Y rule. It can be a procedure or a process. It typically is, about 60% of the time. Here we have our Y. We put it on end. We have endoscopy. Now note the pronunciation. Endoscope, endoscopy. just the way it works in medical terminology. You'll get used to it. It is not an endoscopy, although people will say that. And endoscopy, of course, is a visual examination of a body cavity or organ. If you'll recall, I told you a while ago, I was going to teach you the rules. I'm going to say they're always correct, and then I'm going to teach you how to break the rules. And here's our first good lesson in that. Can anyone tell me where the combining form is in this word? Exactly. There's not one. So here's the first thing about word building rules that we talked about. And I said I'll be presenting things to you in combining forms, which is true for nouns, meaning body parts, organs, and so on and so forth. But other ancillary aspects like procedures, for instance, and even some anatomy consists of a prefix and a suffix put together without a combining form. So that rule that I kind of told you is an absolute isn't absolutely an absolute. It applies for most things, but not all. So you'll see this as we proceed now. You're going to see a lot of words that will be a prefix and a suffix, and there will be no noun in there. But it's referring to a procedure. Now we put those together. We have endoscope. That is a noun because you can handle an endoscope. It's a thing. Endoscopy is a procedure or a process. So took a few extra seconds there to explain that to you. Some of you may have seen that when you first saw this slide, that there is no combining form. And if that's what you noted, you are absolutely correct. Now, in the world of radiology, we have something called an MRI. It means magnetic resonance imaging. Maybe some of you have had them before. They're big machines like this. They're the big tube that you go in. So we place the patient on the table. They slide inside that machine. Modern MRIs aren't as big as what you're seeing here. This is not to scale. That tunnel you see this patient being fed into is usually not that big. And for those of you who've had MRIs, you know that it's actually just about big enough to fit your body. Not a great place to be if you're claustrophobic. So I've had them before. It wasn't the most fun I'd ever have. An MRI is a radiological imaging technique that uses magnetic energy to create detailed cross-sectional images of organs and tissues within the body. During an MRI scan, a narrow table moves the patient through a tunnel-like structure, which creates a magnetic field through which radio waves are sent, creating a 3D image of the internal structures. So I know a little bit about MRI. I've learned about it in the RT program. I'm not really set to learn MRI in a formal way. I don't think I'll ever practice that type of medicine. I'm more interested in CT. However, MRIs are amazing. You have to be very careful around these machines. If you're ever around them, they have very strong magnets. They can pick up a very, very large, heavy object and fling it across the room. And if you get between the magnet and that object, it will be a bad outcome. So we have to be very cautious about metal in these rooms. I remember when I was over at Natividad, they were taking one machine down and they let us throw metal balls at it. And the force that they hit the machine with were amazing. They were breaking that machine down. It was being scrapped out anyway, so they let us have some fun with it. The power in these magnets is extremely strong. So be careful around these. They're great machines, though, because we get this type of study without radiation. Versus CT, which I just mentioned a moment before. I'm very interested in CT. It's computed tomography. Tomography means the process of cutting into small slices. So this is a radiological imaging technique that uses a computer to produce cross-sectional images of a body structure. So if you look at the diagram here on the left, that is a CT. In the upper left corner, you read this like you would read a book. So you start in the upper left corner. Each of those images is moving just a little bit higher within this patient's skull. So it's starting down around the chin. And the very last one in the lower right corner is the very tippy top of the skull. Everything else you see in between there are small slices. As the patient moves through the CT, it's making these images. You'll see the diagram here of the person with the eyes closed, and there's a circle around the mass, and that leads directly over to an actual CT image of a brain tumor found in a patient in the superior orbital region, I guess is what you'd say. That's a tumor that would not have been found were it not for CT. You know, Da Vinci was able to take deceased people and cut them open and see what things look like inside. Doesn't work for live patients. You may find what you're looking for, but the process won't preserve the patient's life, obviously. So CT is a wonderful job. It does a wonderful job of that. Without CT, this tumor would be undetectable. It would be symptomatic, and it would manifest itself however it decided to go. Now that with the CT, it's discovered that mass, and you can see it circled here in the lower right corner in the image. That tumor can actually be treated now. So, a wonderful tool. Ultrasound, most of you are probably familiar with ultrasound. It is a radiological image technique that uses sound waves to produce images of internal body structures. So it simply sends sound waves out. Depending on how quickly they bounce back, it assigns a shade of gray, white, or black, and that's how the image is made. The lighter it is, the more dense the material is, and the closer the material is to the wand. Things in the distance tend to be darker. That's ultrasound. For you moms out there, I know you've definitely had ultrasound experience because it happens during pregnancy frequently. A PET is a positron emission tomography. This is an image test that helps reveal how tissues and organs are functioning. It uses a radioactive substance called a tracer to look for diseases in the body. It's used to diagnose cancer, heart disease, brain disorder. So a PET scan, positron emission tomography, is a combination of CT, computed tomography, and a radioactive contrast. Most contrast we used is not radioactive. However, in this type of study, it is. So we're actually giving the patient something that has radiation in it. It has a very short half-life. So it's like using regular contrast. The difference is it is, once again, radioactive. And so we take images based on that. These images here illustrate very well how great PET is, especially for the neurological system, primarily the brain. We see normal brain activity on the left and mild Alzheimer's disease on the right. You can literally see the plaque building up in between the neurons on the brain on the right. You can physically see it. It used to be with Alzheimer's, we just had to look at symptoms because we couldn't see inside the brain. So as the person started to, degenerate, the brain degenerate, we would see that manifest itself symptomatically, but it was very hard to collect data on it. There's the data right there. And on the note of contrast medium, we use contrast in radiology all the time. These are chemical substances used in medical X-ray, MRI, CT, angiography, which is a form of radiography, a form of fluoroscopy, and occasionally in ultrasound, although rarely. Contrast media will enhance and improve the quality of images, and using contrast media will enhance contrast between different parts of the body, and that's all very true. Those of you on the road for RadTech, you'll learn a lot about how contrast is used. Those of you involved in medical assisting and nursing will learn more about the protocols of when it should be used. Of course, radiographers will too. We also learn about what it does. Most contrast medium is perfectly harmless. If someone has an iodine allergy, we don't administer certain types of contrast. They may react. What you're seeing here is called a lower GI or a barium enema. In this case, we've put barium in the colon, and then we take pictures as it moves through to see if there's tumors, lesions, anything like that. Most of these things are benign. The one exception was the one I mentioned with the PET scan. That is radioactive. It's not dangerous per se, but it requires a pretty strict protocol. So the summary here is most contrast medium, in fact, 99% of it is very safe to use. We do have the radioactive. We don't use it unless we need it, but if you need it, you really need it. So it's always on that scale of medicine, the balance between risk and benefit. Sometimes the risk equals the benefit, or sometimes the benefit, rather, will equal the risk, sometimes not. If it's life and death, that changes the whole way we look at that. All right, I'm out of time on this segment. I'm going to be back and sum this chapter up in the next segment, and then we will be ready to move on to chapter 3. So I'll be back with you in just one moment.